I will talk about childhood cancer, and I title it "The Surprising Scientific Facts About Childhood Cancer." Why I choose this topic and put it like that? Because I believe that many of participants have not heard about this yet, so they will feel surprised when I tell them about this information. Sorry. Why we need to talk about childhood cancer? Because if we do a diagnosis in an 80 years old man with cancer, and he could access to 200 drugs, his life expectancy is around 2 years. But if we do diagnosis of cancer in a 2 years old child who could access to only 3 drugs, the life expectancy of this child is 80 years. So we need to talk about childhood cancer. Every day around 1,000 children are diagnosed with cancer every day. And once the diagnosis is made, the whole family, the life of the whole family change. And actually, childhood cancer is curable if the patient could get the right diagnosis, treatment, and supportive care. However, only 20% of children with cancer in low and medium income country could be curable, whereas 80% in high income country. And globally, 44% of children with cancer will die before diagnosis. In Europe, the statistic of childhood cancer is around 130 new cases per year in children less than 15 years old. And we noticed that in poor country, in low and medium income country, the rate is lower. But why? We need to ask why. Is it because not many cancer cases in those countries, or because of misdiagnosis or other problem? In Cambodia, there is no statistic because cancer registry is not yet available. But we could estimate it using like 130 new case per million children less than 50 years old, multiplied by number of children less than 15 years old in our country. We could estimate around 700 new cases per year in Cambodia. But how many cases we receive exactly? As cancer registry is not available, I could do just a small informal research by calling my colleague around the country who treat cancer in children. And I found that in total, we received in 2018 only 1/3 of estimated case, around 220 new case in 2018. So only 1/3. And where are the other 2/3? Where are they? For me, I think first of the misdiagnosis because of the lack of awareness. That's why we need to increase awareness by talking now about childhood cancer. And the children could pass away before diagnosis as well. And maybe diagnosis is made, but the family refuse the treatment. They have no hope that the children could be cured. That's why they prefer to go back home rather than going to treatment center. For childhood cancer, the most common disease is leukemia, followed by central nervous system tumor. And I find it just quite the same in Cambodia. The symptoms of childhood cancer are different depending on type of cancer, location, and severity. That's why it's hard to say it, in common, what are the symptoms of childhood cancer, but we could tell it when we choose one type of cancer to talk. Another important message from me during my talk is to tell that cancer in children are different from cancer in adults for many reasons. First, in children, the response of treatment is better, that lead to better survival rate compared to adult cancer. Even the location of cancer is different. For example, if we talk about lung cancer, a kind of lung cancer, we could rarely find in children, like adenocarcinoma of the lung in children. We could see very rarely but it's quite common in adults. So even the location are different. The pathology are different also. For example, acute lymphoblastic leukemia in adult in children, the name are quite the same, but we could say it is almost two different pathology because the prognosis is different, the treatment is different. So in adult and in children, even the name of the disease is the same, but they are different. And we always think that how could children tolerate chemotherapy because it's quite hard for adults already. So how could children support that kind of treatment? But this is the misunderstanding. Actually, children tend to tolerate therapy better than adults. And the cause is more likely by a genetic change rather than lifestyle. Another different point with adult cancer. But the growth and metastasis of childhood cancer is quicker than in adult. So we need to do the diagnosis and treatment as early as possible. Why it is important in Cambodia to know this difference? Because adult cancer, it is more advanced in this country compared to childhood cancer. So everyone always assume that childhood cancer and adult cancer are the same. So they feel hopeless when diagnosed cancer in children. But actually, I repeat again that the overall survival in children are a lot better than in adults. So please do not compare that two types of cancer. Luckily, WHO is launching a program called the Global Initiative for Childhood Cancer. And the aim is to increase survival rate around the world to 60%. So I believe Cambodia will benefit from this project as well. St. Jude Children's Hospital, research hospital, has published an article saying that survivors who passed the 5-year milestone are now living longer. It means that if they could pass the 5-year survival rate of 15-year survival rate for 5-year survivor increased until 94%. This is the statistics in long ago, since 1990. Yeah, they show that those who could reach 5-year survival could live more than 15 years. But most of them will have chronic health condition. Yeah, that is the problem. There are many organ or body dysfunction, growth retardation, physical and mental problem, mood and feeling, so many complications. That's why they need long-term follow-up. I also saw some survival in Cambodia treated in National Cancer Center. Yeah, I saw the photo of one 10-year-old boy with funny face. He is the survivor of a rhabdomyosarcoma. Another girl, a 10-year-old girl, survival of nephroblastima. For survival of Burkitt lymphoma with different age, an 8-year-old girl, a 12-year-old boy, 11-year-old boy, and a 3-year-old boy. 4 of them are survivors of Burkitt lymphoma treated in National Cancer Center. Also, I saw some photo and age of children who are survivors of leukemia. In my slide, I put a photo of a powerful politician in Cambodia who joined my talk named Grant for Kids. I talk about childhood cancer, and he is the honor guest come and listen to us. It means that he know about childhood cancer, and he tend to support us. I put one phrase, because children could not fight cancer alone. And the next slide, they do need us to help. And in that slide, I put the activity of our staff taking care of children with cancer in our center. And in conclusion, I have four sentences to tell our audience. First, childhood cancer does exist because in Cambodia years ago, they did not believe that cancer in children exists. That's why the diagnosis could be done, because even when they found a tumor, they don't do pathology examination. They could cut or take the tumor out without examination, believing that there is no cancer in children. So my message is to tell that cancer in children does exist. The cure rate is higher than in adults, but very different depending on setting where they live and they treat. And they tolerate better to chemotherapy than adult patients. And the last message is that the treatment of childhood cancer is cost effective in all settings. So we should treat them.